Thank you, Sir Graham. It's a pleasure to serve under your chairmanship. And first of all, may I also put on record my personal tribute to Cheryl Gillan, a sad loss, who there is no parliamentarian who did more to champion the rights and opportunities for those with autism. And I had great pleasure as the Minister of Disabled People to meet with her, work with her, respond to her very comprehensive, proactive, constructive letters, asks and challenges of us. And for me, with my ministerial hat on, her greatest legacy is how much she achieved for those who were so reliant on having that strong voice in Parliament. I'd also like to thank my honourable friend, the Honourable Friend for Romsey and Southampton North, who not only has spoken very passionately in this debate, but has shown through her excellent chairmanship of the Women and Equality Select Committee how she is holding both the government and the whole of Parliament to account on a number of very, very serious issues. It is very clear she is a formidable parliamentarian, one of our colleagues held in the highest regards, and frankly it's staggering that she isn't in the Cabinet and helping to lead the changes that are often raised and we must keep a laser focus on. Now, Sir Graham, the unprecedented challenges of COVID have impacted all, including disabled people, as highlighted by this very important Women and Equality Select Committee report. In my role as the Minister for Disabled People, I welcome the opportunity to talk through the measures by this very important Women and Equality Select Committee report. In my role as the Minister for Disabled People, I welcome the opportunity to talk through the measures my cross-government capacity and that of the Disability Unit, which I am responsible for, is to influence and shape government policies, sharing our subject matter expertise, data and knowledge of lived experiences, and connecting relevant stakeholders with colleagues across government to reach the best outcomes for disabled people. Now, before I turn to the specific points raised by my honourable friend and the reports, I would like to say how proud I am at the rollout of the vaccination programme, which was an absolutely key issue and ask of the disability stakeholders programme, which was an absolutely key issue and ask of the disability stakeholders that I regularly meet with. The government is now offering vaccines to people, and health and social care staff have been offered a vaccine. I'm very pleased that my own department is linked with NHS services in England, sharing data on over 600,000 carers, allowing the NHS to invite these carers to book an appointment for a vaccine. This is a huge achievement and makes a significant impact on the lives of disabled people as they navigate this pandemic. This is a good example of cross-government work. So Graham, now turning to the specific points raised. From the very start of the pandemic, we have ensured that the views of disabled people and their families and carers have been taken into account when considering how best to support disabled people and link through to the relevant ministers, departments and agencies. Now, casting our minds back to the very beginning of the pandemic, there was very real concern about access to food and medicine, and I know a number of the people who spoke in this debate have highlighted this. Now, in normal circumstances, typically governments would take 12 to 18 months to develop policies, engaging, consulting, piloting before implementing new legislation. But with the challenges of COVID, this time was simply not available. Therefore, by connecting key stakeholders with real lived experience, we were able to help relevant ministers and departments develop responses quickly. So, for example, we linked stakeholders including Disability Rights UK, Scope, Sense, Leonard Cheshire and the RNIB with the Minister for Farming, Fishing and Food and her officials to engage through the Food Vulnerability Stakeholder Group. Within days, they were able to resolve a potentially very serious issue, as the committee report highlights. This is an example of best practice. There have been a number of speakers who then raised the challenge for those who didn't get included in the clinically extremely vulnerable list. But there was an additional scheme that was organised through 305 local authorities, Age UK, Mind, Scope and RNIB, who were able to then make referrals for priority online shopping slots. Again, important changes that were vital. And more widely, to identify potential issues and areas of real lived experiences, we have an extensive programme of engagement. So Graham, I regularly meet with the Disability Charities Consortium, which includes Scope, Leonard Cheshire, and an extensive programme of engagement. So Graham, I regularly meet with the Disability Charities Consortium, which includes Scope, Leonard Cheshire, Disability Rights UK, National Autistic Society, MINDS, being joined by relevant ministerial colleagues to discuss aspects of the pandemic on disabled people. This forum during COVID-19 has included meetings with the Minister for COVID vaccine deployment, the Minister for Care and the Minister for Civil Society, a real opportunity to share their expertise and help shape those urgent new policies needed to support those most vulnerable in society. Furthermore, the Cabinet Office COVID-19 Task Force considers disproportionately impacted groups, including disabled people, through policy development tackling the pandemic. They do this through close working with the Equality Hub and within it the Disability Unit, coordinating with other government departments and wider stakeholders to ensure a holistic approach to policy implications and delivery. In addition, we have our regular stakeholder engagement through our regional network. This includes disabled people's carers and, crucially, those with real lived experiences. So, Graham, turning to accessibility, I want to reaffirm that it is vital that public information on COVID-19 is accessible to all, and we have made key strides in this area. These were things I was challenged on in my stakeholder engagement, and I happily raise this across government. The government is committed to providing both key COVID-related guidance and communications in alternative formats, including large print, easy read, British Sign Language and audio. Most recently, this has covered ensuring national restrictions, vaccination testing and the government's roadmap are accessible. We have now established BSL interpretation at the number 10 press conference via the BBC News Channel and iPlayer, available on all TV packages as part of Freeview. Accessible information is also available on government's social media channels. A significant further improvement following the committee's report, the Cabinet Office now has a senior lead for accessible communications as part of the National Resilience Communications Hub, who meets with a group of disability charities on a monthly basis. The group is briefed on the latest COVID-19 guidance, including accessible versions, and works to ensure that communications to disabled people continue to be accessible and timely. Most recently, we've held bespoke briefing sessions with the Disability Communications Working Group on the 25th of March, explaining the roadmap and communications activity enabling charities to brief their audience, prepare and share accessible communications through their network. This is something I have personally pushed very hard for, and I thank the Women and Equality Select Committee for their support on the need for this vital additional layer of support. So, Graham, turning to health and social care, as we've seen, the COVID-19 pandemic has had an unprecedented impact on the NHS and social care systems. Recognising the challenges in care settings, DHSC made £546 million available in its adult social care winter plan, including money for vital infection control measures to ensure that disabled people getting social care support are kept as safe as possible. The government has also made £4.6 billion available to local authorities to address pressures on local services, including adult social care. And furthermore, the Minister for Health and Suicide Prevention announced £500 million for mental health recovery, of which £31 million will be used to support learning disability and autism services. This is alongside an additional £3.6 million announced by the Minister for Care for disability voluntary sector organisations to provide practical support to disabled people to mitigate the impacts of COVID-19. I know many disabled people and their families have raised concerns about easements to the Care Act. This was introduced as a temporary measure to help local authorities continue to meet the most urgent and acute needs in the face of COVID-19, when local authorities were experiencing extraordinary pressures. This was used sparingly and has now ended. And in response to concerns about the use of do not resuscitate decisions and the clinical frailty scale, the government recognised the issues and guidance was changed strongly and quickly. So, Graham, it's important to recognise the particular challenges the COVID-19 outbreak has had on families of children with disabilities or serious illnesses. Supporting vulnerable children is a priority for this government and has been central to our response throughout the pandemic. Turning to the work done by the Minister for Children and Families, the government provided £40.8 million for the Family Fund in 2020-21, which supported over 90,000 low-income families raising children who are disabled or seriously ill. I know there are concerns about the legal duties to provide support to children and young people with EHC plans. The Secretary of State for Education has not used this power since July last year and has made it clear that he would need a compelling reason before doing so again. Yes.
I thank you for giving way on that specific point about the Secretary of State for Education's powers and the fact that my right honourable friend, the Secretary of State, has made it very clear that he would require a compelling reason to use them, but he hasn't used them. He doesn't plan to use them. There is much less need to use them. Can my honourable friend indicate whether there might be a timescale as to when they're going to go?
That's a fair challenge. I don't have the answer on that, but I will certainly make sure that the Secretary of State for Education gives a clear response to that. And so, Graham, while the COVID-19 pandemic has unavoidably delayed the completion of the SEN review, the Secretary of State for Education is clear that the SEN review remains a key priority for this government. It is vital that we deliver on our promises to children and young people, and I can confirm that DfE intends to publish proposals for consultation in the coming months. So, Graham, a number of speakers also talked about the importance around disability employment, and I'm incredibly proud as the Minister for Disabled People that I presided over record disability employment. In normal times, when I have the pleasure of travelling around the country on visits and I talk to particularly young disabled people and say, if you were the Minister, what would be the single thing that you would want to see? And without question, nearly always it is, I just want to have the same opportunities that my friends have for work and career progression. So I've never lost sight of that. And I speak as somebody who has employed and benefited from employing disabled people both prior to being an MP and as an MP. And yes, we have had unprecedented challenges, but we have not lessened our ambition to have 1 million more disabled people in work by 2027. I want to reiterate and put on record that has not changed. And during COVID, we have made changes to the support we provided. We've recently announced over 300 more disability employment advisors, which will take it to over 1,000. We are continuing to review our health and work programme. All of the plan for jobs is fully inclusive, and that we've made changes to schemes such as Access to Work, where we now provide support within the workplace, and we will keep that beyond COVID-19, which will open up opportunities for perhaps more people who haven't been able to access work opportunities up to now. And I'm very proud that we have reached 20,000 employers signed up to Disability Confident, the equivalent of 11.2 million employees are now represented by businesses in the Disability Confident scheme, sharing best practice about helping disabled people into work, to progress in work and be retained in work. So that is very much a priority for myself and my department. And so, Graham, while there will undoubtedly be opportunities to learn from our COVID-19 response in the longer term, the overall picture is that this government moved fast and flexibly to provide support for disabled people in these unprecedented times. It is absolutely clear the importance of cross-government work linked to and supported by those with real lived experiences allows us to move faster and more flexibly to provide support to those most in need, including those with disabilities. To make sure this is embedded into the very heart of the government, we now have ministerial disability champions in every department who I meet with regularly with the full authority of the Prime Minister, and they are genuinely enthused, engaged and determined to play their part on behalf of their respective departments. In our forthcoming ambitious national strategy for disabled people, we will demonstrate the very real and vital focus on cross-government work to remove barriers and create a fully inclusive society as we return to normality. In conclusion, Sir Graham, I want to also put on record my thanks to all of the staff and the volunteers across the country who've been working on the front line, supporting those, particularly with disabilities, as we navigate those challenges. And I'd like to thank again my honourable friend and her committee for their fantastic ongoing work, the very important report and the recommendations that were made, for which this government and I personally take very seriously and we are acting on.